We're in difficult circumstance right now with cases spreading in the South in many states, and we're seeing what appears to be exponential growth without a real clear backstop. We're probably going to eclipse 50,000 diagnosed cases a day at some point later this week and could get well into the 50,000 to 60,000 range in terms of the new cases that get diagnosed on Thursday and Friday, when we're probably going to hit the peak number of infections. There's sort of a cyclical pattern to infections every week where it comes down over the weekend into Monday because of reporting, and then you see it go back up towards the end of the week. But make no mistake, we're having probably 400 to 500,000 new infections a day right now. What Dr. Fauci's talking about is the number of cases that are actually diagnosed. But we're only diagnosing probably 1 in 10 infections nationally. That's what CDC has said. And in the epidemic states, we're probably diagnosing a little less than that because the diagnostic capabilities are getting pressed right now. So we're probably having 400,000 to 500,000 new infections a day nationally right now, and diagnosing about 40 to 50,000 of them.
How much of this is because states reopened too soon?
Well, clearly that's some of what's going on. We reopened against the backdrop of a lot of spread. And so you had a lot of cases. You reopened against that backdrop. I think that there was some hope that there would be a seasonal effect here, and that would be a backstop against continued spread. But when you reopen and you're having thousands of cases a day, and we reopened against the backdrop of 20,000 cases a day, there's only one way to go, and you're going to increase the number of cases. We knew cases were going to go up. I think what we didn't expect was this scope of outbreaks and epidemics in these states. And remember, these are chains of transmission that were lit weeks ago. These chains of transmission started 6 weeks ago, 4 weeks ago. So this isn't a recent surge in new infections. This has been building for some time, and now we're seeing the manifestations of it in terms of people presenting to hospitals for health care. Another
record-setting day in Texas, almost 7,000 cases there. Miami-Dade now has a positivity rate of 17.7%. That's alarming evidence of a massive spread going on there. What does it say, Dr. Gottlieb, that we're still unable to deal with this virus?
It's a difficult virus. I mean, we're going to get to either herd immunity or a vaccine. It's going to be difficult to get this under control because the whole trajectory as we get into the fall is going to make it even more difficult. And so even if we were to implement very vigorous measures right now in these states in the South, it's going to take a number of weeks before you would get it under control. We're not taking those measures. So what we're dependent upon is the collective action of individual people really starting to be more vigilant. But absent that, if we take some level of infection like this into the fall, it collides with flu season, and you start to confound the ability to diagnose COVID because people are now presenting with flu, this is only going to go up. And so the doubling time right now nationally is under 40 days, the epidemic doubling time, the cumulative incidence. And so if you keep doubling at that rate, you double every 40 days, every 30 days, eventually you get to a level of spread where it starts to decline just because that many people have been infected. And hopefully we can preserve life in that setting. We are getting a lot better at treating that, so that's the good news. We are preserving more life, but a lot of people are going to have to get infected between now and then.
How much of this has to do with the fact that there was an unwillingness not only to wear masks, but the fact that the mask issue was politicized in and of itself? Now you have some folks coming out and suggesting we should wear a mask, but is it too little too late? The virus, as you said, has already been spreading in these places, especially in the South, for weeks.
Well, it's never too late. If we can get adherence to masks right now, more universal adherence, we can get better quality masks into the hands of particularly vulnerable people, that could have a real impact on this. And the literature is mixed on this, but most of the studies that have looked at this show that if you have universal masking, you can reduce the R below 1. There's some articles that say you can't, a lot that say you can, but it certainly is going to have an impact on the epidemic. Look, we mandate seatbelts in this country, largely to protect passengers and to lower insurance rates. I don't know why we can't mandate masks in the setting of a pandemic. We can do this. The first thing that needs to happen, though, is CDC needs to change its guidance. Right now on the CDC website, it says that you should wear a mask when you can't socially distance. We should say you should wear a mask whenever you go out into a public setting where you might be in a circumstance where you can't socially distance. We should recommend universal masking. So what the officials have been saying in many cases is consistent with what the CDC guidance says. The CDC guidance really needs to change at this point.
Goldman Sachs today on that very issue said today that a national mask mandate could preserve 5% of GDP. That's a significant number.
Look, this would probably have to be done at the state level. I'm not sure what the authority would be to do it federally, but the CDC can issue federal guidance, and then the states can adopt that. But you're seeing some states start to tip over that were resistant initially and start to recommend universal masking. They can put in place laws that mandate it. They don't need to fine people. Governors talk about, well, we're going to have to arrest people and fine people. No, we won't. You can give people a warning. You can, allow businesses to decline service, deny service, allow public venues to deny entry if people don't have masks, if the ordinance is in place. So there's ways you can do this that are short of fining people or locking people up like they're doing in Singapore. I think we can do this. I think we're going to need to do it. We're going to end up doing this probably. Hopefully we don't do it too late.